Hi, and welcome back. Let's talk about weight loss surgery today. Before we really get into this, I want to tell you that I had weight loss surgery 12 years ago, and it changed my life. So, when I'm talking to you about this, I'm not some thin lady who has not had to work on this. I know what I'm talking about, and I'm here to help you get through it. What types of surgery are there? Well, the surgery that I personally had is called the gastric sleeve. It's where they cut out about 70-ish% of your stomach and make it the size and shape essentially of a hot dog. There's also a lap band, which is a band that goes around the top part of your stomach and therefore restricting the size of the pouch where food collects. There's also a gastric bypass, where they actually bypass part of the stomach and go into the small intestine. There are some other surgeries like the duodenal switch, but they are not quite as commonly used these days. Are you a candidate for bariatric or weight loss surgery? Well, it depends on several things. One is, how much weight do you have to lose? If you only have 15 or 20 pounds to lose, then it may not be the best option. If you have 50, 75, or 100 pounds to lose, then it may be a very good option, especially if you have other comorbidities or other health factors that increase your risks of dying or having a heart attack or stroke. So if you have back pain or sleep apnea or high blood pressure, then it very well may be a good idea for you. Some people feel like having weight loss surgery is the easy way out. And to those people, I would say they don't know what they're talking about. Having gone through this myself, it's the hardest thing that I've ever done, including having twins or going through medical school and residency, because it's deeply personal and you have to change yourself to be successful. So, while you do see more rapid weight loss than you would with other traditional programs, ultimately, the burden is still on yourself to maintain that weight and to do the right things. Some people feel like weight loss surgery is dangerous. Well, in some cases that may be true, but I would counter that with being severely overweight or obese is also quite dangerous. And most surgery centers in the United States are very safe and have very good plans in place to make sure that you are safe when you do this. You're at much higher risk of dying of heart disease or diabetes-related complications than you are of the almost negligible risk of having weight loss surgery. Is weight loss surgery permanent? The answer is yes. While the lap band can be adjusted or ultimately removed if you have complications with it, you need to go into weight loss surgery thinking that this is forever. That's one of the reasons that I chose the gastric sleeve, because in my mind I knew that I could never go back to the way that I had done things before. It's a massive change that you undertake in your body, but can be so important toward being a healthier you in the future. A lot of people ask, do I still have to eat right and exercise even if I have surgery? Yes, you do. If you want to maintain that weight loss, you have to approach this knowing that your life can't be the same. The recipe for getting where you are is what you have been doing. So you can't just do this for a short amount of time, then go back to what you've been doing and expect it to maintain your results long term. I hate to break it to you, but you have to make permanent changes.